Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sherry Harlan, program host for Let's Talk Together, and today we are discussing tobacco prevention and cessation, and our guest today is Andrew Hoover. Welcome, Andrew.
Hello, Sherry. How are you?
I'm great.
It's always good to be a guest with you.
Well, thank you. And update us on your background. You've been here before, but I'm thinking you're making some changes, so give us an update on why you're here today.
So I think I'm personally trying to go for the record. I think you hold the record, but I'm trying to go for the record of the most job titles I can have at Reid.
Okay.
So I've been at Reid 5 years this last month, and starting a new role as our tobacco control coordinator with Reid's newest department around tobacco prevention and cessation. And for the record, this will be my 5th job in 5 years at Reid. But it's great because I just continue to keep finding areas where I fit in the puzzle of Reid, and this is just another way that hopefully we can continue to give back and find new ways to help our community.
Give us a little bit more how this position came to be.
Yeah, absolutely. So the Indiana Department of Health has grants available to all 92 counties based on tobacco prevention and cessation. Reid applied for one of these grants earlier this year. And to be honest, most of the counties that Reid serves do not have this grant filled. So those are gaps where money could be coming in to fund these positions. So Reid applied for this grant. That grant covers my position to basically highlight tobacco prevention and cessation efforts in the area. The goal of this investment is a collaboration between Reid and the state, but the state realizes that when they're giving these grants to communities, they are putting people on the ground that know their communities. For instance, trusting Reid with this investment, Reid is able to go into the community and start working with people that we already know, connections we already have, to build on those connections. Whereas if somebody else comes into the city, you know this, it's hard to get your feet on the ground in a city, but if you're already established, that's where this grant plays such a huge part.
And now, is this grant just only for Wayne County?
At this time, yes.
Okay.
So we are just doing Wayne County right now. Our grant is funded until about mid-2027 currently. But around the early 2027, we will be able to look at expanding that grant into more counties that Reid serves.
What are some of the goals of this new department?
So the really cool part about this department is it is kind of fueling a lasting impact on our community. Some of that work includes, of course, tobacco prevention and cessation. We'll be working with local schools to build collaborations and relationships. And some of those will look like educating our students on tobacco prevention and cessation, and also working to reduce the use amongst our kids. We'll also be working closely with local employers to push prevention and cessation efforts. We know from a lot of our employers they want this type of thing because ultimately the less smokers a company has, the lower insurance premiums are. Everybody wants a lower insurance premium.
Right.
And then also we'll be working hand in hand with our medical providers, not only at Reid, but throughout the community to push cessation efforts through Quit Now, which we'll talk about more later. But just kind of being a resource for all these different people in the community. And then lastly, one of the really big parts is trying to build a local coalition. And this local coalition will be different community stakeholders coming together against this common issue. And I did want to clarify, too, that when we say the word tobacco, we kind of mean the overarching effects of all things nicotine. So tobacco, e-cigarettes, vaping, nicotine pouches, all these things it's all under that tobacco umbrella. I get
Okay.
that question a lot, like, why are you focusing on tobacco? All these kids are vaping. It's the overarching umbrella of saying that. So,
One of the things, will you help within the hospital?
so we will be a resource for not only Reid patients and Reid providers, but also throughout the whole community. Since our grant is funded through the Indiana Department of Health, we'll be working with our partners at Neighborhood Health, Meridian, Centerstone, and just kind of giving this service to anybody and everybody that wants it. My goal is to just become kind of like the little fly that's just flying around talking to everybody about tobacco prevention and cessation. That's kind of the goal, is we're bringing awareness to the issue that is so important, but we've kind of had some gaps in our efforts throughout our county and our service area.
Well, I'm excited that, especially as you're trying to develop a coalition, that it's not just a Reid thing, it's like our entire community. So tell us more as you're building the coalition, how that works.
Absolutely. So we have a lot of work to do on that coalition. There's a lot that goes into a coalition. But Reid's Community Health and Engagement Team, which of course you're part of, and before I stepped into this role, I was part of our community health team, but still working closely with our community engagement team, obviously. We've been working ahead, knowing that we were hoping to get this grant, but we kind of already have a work group of some people that are working on tobacco. That includes Neighborhood Health Center, Boys and Girls Club of Wayne County, Purdue University Extension, and the Wayne County Health Department. We've been meeting with them for almost a year now to help kind of lay the groundwork of what could become a tobacco coalition. We use these meetings as a time to discuss what we're currently doing in that space, but also to come up with ideas, events, and ways to collaborate in the community to kind of have a coalition or a broad effort to reduce the number of tobacco use in our area, which I think is super important. And we're excited to see this coalition grow and invite more partners as we continue. We're only about a month in right now, but we are going to continue to find new partners and new collaborators to come in with us, especially as we grow into our schools and our employers and our medical offices. It's going to be really, really important to include more and more partners.
And I know we will show information on how to contact you, but for instance, if one of our viewers was to see this and think that they have a problem or they need assistance, then they can call you or one of the partners?
Absolutely. So any of us are going to have the information to push somebody where they need to go, but especially I know we're definitely going to be hitting on Quit Now here soon. And that'll kind of be our effort to get people to quit smoking, or if they're looking to quit using a tobacco product, absolutely we can push them that way.
So what currently has tobacco prevention and cessation, how's that work in Wayne County?
Currently, it's just kind of creating partnerships with some of our medical providers to push them to quit now. So our Quit Now program is free through the state of Indiana. So Quit Now is a program that's across the whole country, actually, but Indiana has Quit Now Indiana. It's kind of their branding of it. But it's a free program for residents that are wanting to quit. Quit Now offers support, coaching sessions, quit guides. They can even offer nicotine replacement therapy medications to those wishing to quit. And that's for those that qualify. Not everybody might get those. You do have to kind of go through the steps first to get those. But what's great about that is that when somebody uses a nicotine replacement medication, studies show that pretty much cuts their chances of quitting about in half. So it increases their chances of quitting, which is great. The other cool part is that these resources are going to be brought to Reid providers and other providers in our community like never before. We're going to be working with our employers to push out this Quit Now program, where with some of our local employers per se, we're going to be able to help them track how many of their employees might have. We won't know who did it, but we'll be able to say, oh, we know 2 employees from your company contacted this number. We won't know who they are. We won't know their names, but we will know, how many people. And then we'll be able to help track that success, which I think is so cool to help our local partners, our providers, our employers.
I know in the last 6 months, we did a health fair at one of our local employers, and we were both shocked at when we were talking about tobacco prevention and cessation, how many people mentioned that they had stopped smoking. And so that's a heads up.
It absolutely is. And that is one of the things that we hear, which I think is so cool about this grant, is we hear all the time from our local schools about tobacco and vaping becoming an issue. We hear from our employers about tobacco and vaping becoming an issue. We hear from our providers here at Reid that tobacco and vaping are an issue. Every single doctor at Reid probably mentions the words tobacco and vaping every single day because tobacco and vaping affects every single part of your body. So all three of the core people that we're going to be working with are super excited for this program because it brings awareness and it puts a body in place to bring awareness and education to this topic that's affecting all of us.
You've brought some information on Quit Now, so can you tell us a little bit more about the things that you brought with us today?
Yeah, absolutely. So we're going to be out in the community a lot more. You're going to start seeing us with different educational pieces. So whether it's a lung display or trying to get people up to the table, we have some other displays of trying to showcase people what's happening when you're smoking. What are the negative impacts of smoking? Because there's lots of them.
And on the, I just realized that's actually a cigarette.
It is.
So
This large cigarette's really cool. You have to come up and see us at events, but this cigarette actually turns and it talks about some of the impacts that you'll see after you quit smoking. Which when somebody quits smoking, depending on how long they've been smoking, there are some things that honestly, unfortunately, cannot be fixed. But some people are going to see things happen within 5-10 minutes of quitting smoking, and you're going to continue to see results 20, 30, 40 years after you quit smoking. And this cigarette, it gets people to the table. It looks fun, and then it gets people over. People ask, what is that? And then we start to describe and talk about if you're going to quit. These are some of the things that your body, it's going to happen to your body. The body will slowly start to repair itself. And I think that's the really cool part, is to get people to see that there is a light at the end of the tunnel if you end up quitting your tobacco products. So I think that's the cool part. And then we're obviously going to give them information on Quit Now and educate them on the different areas of Quit Now. And a lot of that education can be tailored, whether it's quitting now for pregnant mothers or teens or adults. There are parts of the Quit Now program that are eligible for teens, which I think is really, really cool. I think the program opens at 13, which is super cool, so that, if there are kids out there that are struggling, they're able to go through this program. Because unfortunately, we have children as young as second grade that are vaping now. So it's an issue that we need to kind of hit head on. So you're going to see us out in the community. Feel free to come and talk to us. Ask us information, ask us questions. We'll be happy to point you in the right direction.
And then the first thing that came to my mind was often, a lot of times on social media, someone said, I am 2 weeks tobacco free. So, and right at the top of my mind, I can't remember the benefits, but by having this information, then I can look and say, well, in 2 weeks, this is what's going to happen to your body or whatever, and make it more celebratory.
Absolutely.
And then just for encouragement.
Absolutely. And we know it's an issue in Wayne County. I brought some stats to share with you if you want to hear some stats.
And share with us.
Healthcare, we love stats. So just in Wayne County alone, a little over 24% of adults in Wayne County are smoking or using a tobacco product. This is well above that national average. The national average is about 14% for adults, and the state average is about 16.2%, and we're at 24%.
Oh, so we're above.
We're quite a bit above. Additionally, in Wayne County alone, 2024 saw nearly 84 births affected by smoking, and nearly 11.3% of pregnant women smoke in Wayne County. So one of our goals is obviously going to be working with our OB department. How can we continue to push not smoking in some of our pregnant mothers? Last year, we had around 109 smoking-related deaths in Wayne County, and smoking has caused well over 3,200 illnesses in Wayne County. We know that smoking is attributed to lots of different chronic diseases. And additionally, in Indiana alone, we know that about 1 in 20 high school students and about 1 in 40 middle school students use e-cigarettes. So that's becoming even more of an issue. So our goal is to address that sooner than later.
Right.
And you and I both know we worked closely on Reid's Community Health Needs Assessment. The Community Health Needs Assessment that Reid Community Engagement does is done every 3 years. And it helps us address the issues that are most important to our population. And in the last few years, we've continued to see some trends. Some of those are chronic health and substance misuse. And both of these two things are affected by smoking.
Right.
Smoking causes, not just smoking, but tobacco products cause lots of different chronic disease and chronic illnesses. But also substance misuse. We don't currently think about, you don't always think about that connection. But it does, especially in our youth. It creates that reliance on addiction. It creates an addiction. And studies show that children that start at a young age with smoking and nicotine products, it could lead them to substance misuse down the road as they're continuing to chase that addiction, chase that high. And that's one of the things that we're trying to address as well.
When it's little things, I had a situation where often they have their smokers culture. So people they leave their jobs and they're like, oh, I need a smoke break. And so then it became a battle of people that didn't smoke. Like, they're getting more breaks than I'm getting. Mm-hmm. So those are some of the things like employers have to try to adjust to as well. Absolutely.
It's a lot of smoking it's kind of a mental thing. You start to do certain things. Some of the trainings that I've been through, there's people that have quit smoking and they were doing fine, and then they started to grill, all right? They went outside to light up the grill, to cook some hamburgers and hot dogs for a cookout, and they wanted that cigarette because that's what they typically used to do. It triggered, it gave them a trigger. So that's one of the things that the great parts about Quit Now is that they're going to talk through those triggers with you. So if a viewer is using tobacco products and they want to quit, if they call this 1-800-QUIT-NOW program, they're going to be able to talk to a coach, go through the steps to understand what are their triggers, why are they using these products to help them quit. And that's the cool part. This program is 100% free, and you can call 1-800-784-8669, or you can text READY to 34191. That's 34191. Or visit quitnowindiana.com for more info. But they will guide you through some of those triggers that you might have. Help you figure out why are you using these products, which I think is really important, because some people will quit for a while and that one little thing happens, and they start using again. But it is common for people to unfortunately relapse like that. It takes multiple tries.
I noticed been doing some health fairs at different schools, especially if the young people saw the dirty, damaged lung compared to a healthy lung, and by the time they were grabbing their parents and to let them know this is what your lung's going to look like because you smoke.
Absolutely.
And it was uncomfortable for some people, because they're like, you can't say that in public, but
absolutely. And I think that's the important thing too, is we're educating kids to where kids are hopefully being able to educate their parents. And unfortunately, we have a lot of parents out there that might not think vaping is that bad. Right. We have a lot of people will say, well, vaping's not as bad as smoking. They are a little bit different, vaping and tobacco, e-cigarettes versus a tobacco cigarette. But I like to say it's kind of like a pendulum. This is not an even scale. All right, there's some things that might not be happening in an e-cigarette that happen in a regular tobacco cigarette, but they are not even. One's not better than the other. And some
we're
of the
still
issues,
learning about vaping.
We are.
And the effects.
And some of those vapes are continuing to change. These companies have a lot of money behind them. So they are looking at ways to change their products. And that's just continually what happens.
So it can't be bad because it had a fruity flavor.
Exactly. And that's one of the things that hopefully we can educate parents on and educate the community. Like I said, you're going to see us out at events, but also one of the goals is to host some community educational seminars throughout the community, maybe at libraries, things like that, to where you can come out and learn about some of these products that you might not know about, right. Or learn why are these things happening, how can you talk to your children, I think is one of the important topics.
And I think that's probably where it's so important, because if the children see it, then they don't begin that habit, or then you can't hardly say no to someone that's looking at you lovingly and saying, you're hurting me and you're hurting you. So I'm really excited about the prospect of going into the schools, because I've seen people actually change because their child asked them not to smoke.
Absolutely, and I think that's the cool part about this grant is, like I said, is it fuels that local impact. The goal is that we're talking about this. We've had things like this in the past at Reid, where we've had people working on tobacco prevention and cessation. Of course, our community health and engagement teams have done that. But this is my 100% full focus now, is addressing these issues every day, working to reduce the number of smokers in our area, whether it's through cessation efforts or prevention efforts, which I think is just going to empower not only our community, but also empower the partners that are working on this, as we mentioned with that coalition, our schools, our employers, our medical providers, to kind of give them an avenue of, what can I do? Where can I send my patient? How can they quit? Who can I contact? And the cool part is we are working in collaboration with the Indiana Department of Health. So they are just a phone call, email away now to be able to get some resources, to get stats, to get data that'll help fuel our impact even further here in Wayne County.
We're really excited about that. And on another note, so if somebody's wanting to quit using tobacco products and they need the resources, how do they go about that?
Absolutely. So as we mentioned, the Quit Now Indiana program is completely free. It's open to all Indiana residents that want to quit. They offer support, coaching sessions, quit guides, and then qualifying participants are able for those nicotine replacement medications that can help ease some of those withdrawal symptoms. These resources, as I said, will soon be brought to some of our Reid providers and things like that. But up on the screen, you'll see, you can utilize this service by calling 1-800-784-8669, or you can text READY to 34191, or visit quitnowindiana.com for more information. There's lots of information there about how you can do this. And then soon, some of our providers at Reid will hopefully be referring you to this program. We're going to be working closer with them so that they're able to refer patients to this program, to where the doctor can send off the referral, and then somebody from Quit Now can contact you.
That's great.
Which is great, because then that puts a little bit more pressure. Somebody's calling you to talk about it, which it is a little bit of a willpower to do it on your own. So definitely talk to your doctor about wanting to quit, and hopefully they can get with us and we can help to get that done.
And I know you discussed it, but explain more a little bit. If you call that number, what actually, walk me through what happens.
So they're going to talk to you a little bit about your smoking. I'm sure there's some legal jargon here and there, this and that, but it is a free program where they're going to start talking to you about your tobacco use. They're going to get to know you. They're going to connect you to what you need to get connected to with a coach, resources, guide you through that quit process, understand your habits, understand why you're using this product, what are you using.
Excuse me, so when you're saying a coach, so they will assign you someone that you're...
So somebody from the program will help coach you through this and talk to you, because you need that support. You need a buddy.
Right.
There's going to be a lot of symptoms, withdrawal symptoms, and things like that come with quitting, and they're going to be able to give you that support, which I think is huge.
That's great. That's great. So what's this type of work mean for Wayne County?
So this program, as we mentioned, is obviously big for us. We know that tobacco and nicotine addiction are the root cause for a lot of issues in our community, whether it's chronic health issues, substance misuse, social determinants of health, and so on. As we mentioned, every single provider at Reid talks about tobacco every single day, I'd imagine, because it's affecting so many different parts of our patients and our community's lives. So this allows us to focus in on tobacco prevention and cessation efforts in Wayne County like never before, which I think is huge. And the cool part about it is we have the complete support of our friends at Indiana Department of Health, which is awesome. We're going to be able to utilize some of that. But also the cool part about this is, as we mentioned, all 92 counties in the state of Indiana are able for this funding. Now, not all 92 counties are, but we're going to be able to work closely with some of these other counties. We've been in collaboration with Delaware County's Tobacco Coalition for like the last year. Jordan Moss leads that program. He's funded by this grant as well, and they have been doing this for quite some time in Delaware County, and they're making huge impacts. So we're going to be able to work closely with some of these partners and learn what they're doing in their communities to see if we can replicate it in our community, share notes, what's happening, learn trends that are happening, which is going to be awesome to bring back to our Reid system and our community with our partners. Also, it's big because Indiana's been making some positive traction on tobacco prevention and cessation efforts in the last year. As many of our viewers probably know, Indiana did increase that tobacco tax on July 1. I've seen lots of angry Facebook posts about it. Some people not very happy about that, but it's a big step to preventing tobacco use in the state of Indiana. Data shows us that tax increases on tobacco are one of the most cost-effective ways to reduce tobacco use, especially in youth. And it's estimated that this tax increase could prompt about 38,000 adult Hoosiers to quit tobacco, which is huge, and then saving the average Hoosier smoker about $4,000 a year. So that's just some
incentive.
that's just some of the positive traction that's already happening. So with that tax, working with the Indiana Department of Health, and some of the information that we're going to be doing, we're going to be conducting some youth surveys and things like that over the next couple of years, hopefully, to where we're going to be able to understand the issue even better for our partners at Indiana Department of Health so that we can continue to combat this issue face on.
And I know when we're talking schools, because we have a lot of higher education, will you be able to work with those institutions?
So ultimately, yes. A lot of our focus right now is going to be on those K-12, but we're not going to turn anybody away if they need help. Absolutely. The Quit Now program, and that's the great part, is this Quit Now program is funded through the state and the government. So you're not going to be talking to a Reid provider about this Quit Now program as far as we will refer you to it, but we're not leading those efforts. So we can open those efforts to any of our partners, provide that education, provide the materials. Absolutely. The more people, the better. I want those Wayne County numbers to shoot up as far as people using Quit Now Indiana. So anybody that's needing that information can reach out and we'll get them that information about Quit Now.
And as we wrap up, what is something that you want everyone to know?
I just want people to know that this is an issue it's important to Reid, and it's important to us to get it out there and to talk to people, and that my phone is always open, my email is always open to come and talk to your group, talk to you about this issue, refer people, and answer questions. And the great part, and I keep saying this, but I think the collaboration between what's going to be of this department and the Indiana Department of Health is huge, because if I don't know the question, I have somebody I can email or call immediately to get those answers. We have a team, literally a team of people from the Indiana Department of Health working with us to help us get data, get answers, get things going, which I think is huge. And we're going to be able to answer those questions. So my thing is if anybody they have a question, whether they are a working professional or a concerned parent or something, reach out to us and we'd be happy to answer questions and hopefully guide them in the right way and get them the answers they need on tobacco, e-cigarettes, vaping, chewing tobacco, nicotine, you name it, we can help them with
all
that.
Tobacco related.
All tobacco related.
That you can talk to Andrew Hoover. And we want to thank you for joining us today on Let's Talk Together.
Absolutely.
And thank you for joining us on Let's Talk Together.